For parents, figuring out the best way to address challenges with aggression and emotional regulation can be so difficult and so challenging. So we're going to share here our interview with licensed psychologist Nicole Yehudai, where Randy and Nicole discuss how she addresses some of these challenges with the families in her practice.
We are here today with Nicole Yehudai, and she is a clinical psychologist, and we're going to talk about a couple of different topics that she deals with on a regular basis in her practice. So Nicole, thank you so much for being with us today. Can you tell us just a little bit about yourself?
Yeah, thank you for having me. So I work primarily with children and adolescents who are on the spectrum. I am a psychologist at Palm Beach Behavioral Health and Wellness, and I work with kids who are all over different levels of the spectrum, from higher functioning to lower functioning. Working with them, with their parents, with the schools, and kind of approaching it from all angles so that we can really get the child everything that he or she needs to succeed and to function at the highest level that they can.
Awesome. All right, so what we're going to do today in a brief amount of time is talk about a couple different topics. So we're going to kind of drill into three different topics that you deal with on a regular basis, and try to work on just some basics, tips, strategies that parents can try to work on themselves, or at least talk to their therapist that they're going to go see for their child to get some ideas of what they may do. The first one being aggression. So if we can talk a little bit about that, that'd be great.
Yeah. So that's kind of one of the main behaviors that we see being a reason for referral, because it's something that, whether it's seen in the schools or in the homes, it's one of the hardest things for people to deal with, and it's one of the easiest things for people to pinpoint as, okay, this is really an issue that we need to target. So sometimes the aggression is towards themselves, sometimes it's towards others. A lot of parents sometimes feel like they don't understand where the aggression comes from, and they feel like it's not really provoked and there's no reasoning behind it. So it makes it much harder for them to try to, kind of target the problem or deal with it, because they can't really predict when or where the aggressive behaviors are going to come out. So I work a lot with the parent and the kid, and every situation is different, but a lot of the times the aggression is a result of frustration. Sometimes it's because, the child doesn't feel like they can communicate things in any other way. And that's probably the biggest thing that we see, is that they don't know how else to express that they are mad or frustrated or sad.
One of the terms, and it probably is as relevant in your world as it is in the ABA world, but you hear it all the time in ABA, is antecedent. And trying to identify the antecedent. I would imagine with aggression, it kind of is the same idea, to try to figure out that genesis, or that starting point, basically.
Yes, and I think that the hardest part is, a lot of times it's things are piling up, and so there's not specifically one antecedent event that triggers the aggression. It's, they were holding it together for the whole day, and then at some point of the day, it's kind of that last straw, and they can't hold it together anymore. So we work a lot on helping identify kind of those little warning signs that come before the blow up, because usually you can see, especially parents can kind of tell when their child is starting to get a little bit frustrated, and to try to address it then before it turns into something bigger.
Is it fair to say there's not necessarily one tip or trick, if I could put it that way? In other words, like, you talk about obviously redirect, you talk about distraction, things along those lines, but I would imagine that, not to make a general statement specific, but it depends upon the child, obviously.
Yeah, it definitely depends on the child. Different things work for different people. So we try different things, right? So there's taking a break is a big one, and that probably works for most people, is encouraging the child, or if the child is old enough or aware enough for them to kind of do that for themselves, is when you see yourself starting to get a little bit frustrated or something's going on before we get to the breaking point, is kind of taking a break. So you remove yourself from the situation, put yourself in a calming environment where you can kind of collect yourself, whether it's, taking deep breaths or some self-talk, trying to get yourself back down to a healthier, more neutral level so that you're not adding stress on stress.
Sure. Do you notice, or is there a way, there's a difference between anger or aggression and a meltdown, where a child, like you're talking about, like self-injurious behavior, things that the child literally can't control, versus aggression for the sake of aggression. In other words, anger probably might be a better way of putting that. Is there a way for a parent to really be able to tell? I mean, it's obviously not going to be bulletproof, but is there a way for a parent to determine kind of the difference between the two?
I think most parents know their kids pretty well and can usually tell the difference between when they really can't control it and they've just kind of been depleted of all their resources, versus when they are trying to be more manipulative in that aggressive way of just being defiant. So usually you can tell the difference, because when there's a meltdown, it feels a little more emotional and you feel a little more of that sadness in it.
Yeah.
Versus the aggression is more, it feels more purposeful.
That's a perfect way to put it. That makes perfect sense. It completely makes perfect sense. One of the things we talked about was communication. So maybe just to touch on that real quick, and the frustrations that can come from the lack of communication or improper communication.
Yeah. So that's probably the biggest issue that I think all people deal with. So whether it's, individuals on a spectrum that I work with, or, couples that come in, or teenagers, or it's just the biggest issue that people have is communication. For kids on the spectrum, it's, especially relevant, and it's also in a different way because they just communicate differently overall. So a lot of things kind of get almost lost in translation when they're trying to communicate with others who look at things differently. So we see that as a big issue of parents learning with us kind of how to best communicate with your child in a way that's going to be most effective, in a way that they can understand. And I work with parents and kids a lot on kind of establishing a common language for them to use, so that they both understand what is meant by the words that they're using. So we kind of have, kind of sometimes our own vocabulary for things, so that it's not being referred to in multiple different ways. And then that kind of leads to confusion. So trying to get, the parents and the teachers and whoever else is working with that child to try to use some of the same language, so that things are consistent and makes it a little bit easier for the child to be able to follow through. Because sometimes the reason why the kid or the client can't succeed or can't get to where we want them to be is because we're not giving them the tools to be able to do it. So communication is really the biggest part. And like I said before, communication is usually the reason for the meltdowns, for the frustration, for, they kind of feel like they have no other way to let out these emotions. And it, teaching them how to talk things through and encouraging parents to have to initiate that sometimes, because the kid might not be able to come up to you and say, I really need to talk about this thing that's
yeah, right.
So for the parent to be able to label it for them and to model that for them and say, you seem like you're feeling really frustrated, and let's talk about that. So giving the kids kind of the language to use, teaching them about their emotions and what they feel like and how to talk about them. Because a lot of these kids also don't understand what emotions they're feeling. They can't even label it for themselves. So how are they going to tell you what it is?
Sure.
So kind of teaching them how to identify what they're feeling and then helping them learn how to communicate that is kind of the next step.
Sure. That's one thing I thought was really important what you said, that it is from a strategy point of view for parents, is the collaboration in the same communication strategy throughout their day or throughout their week. And I think that's so important. I never thought about that before. And it's not even just labeling like the basic types of things, but having that same when they go to school versus when they go to therapy, when they come home, that everybody understands language that child understands. I think that's really, really important.
Yes, it is. It is definitely important. And also consistency as much as possible is important. So while we teach them to be flexible, we also need to try to make an effort to make things as consistent as possible, because just the way life works, I mean, things are going to get
Sure.
thrown in. We don't want to add to that chaos. We want to try to make it as consistent, as stable as possible. And I mean, that's true for all children, right? Like they all need stability and structure, and all of those things are really important. So as much as we can provide that, that would be best, you know, because obviously things come up and it's not perfect, but
Yeah, but to be able to have that, again, that consistency across the board, whereas somebody, you know, if they go to I think of like the ABA world where they try to model things a specific, you know, because it's so evidence-based and you're doing discrete trials, you're trying to get everything, you know, to fit the right way, but you could be doing something that potentially could be counterproductive to what they may be doing in speech, or they may be doing at home, or they may be doing in school.
yes. So that's why I feel like it's really important to get on the same page with all of the providers, if that's possible, with the school, if the kid is in school, and trying to get everyone to kind of work as a team. And, you know, obviously always working really closely with the parent, because they spend most of the time with the child. So I work on, you know, developing skills and working on all of these different things with the child, but then I also make a point to bring the parent into it and show them how to do it as well, so we can generalize these things to outside of my office.
Yeah, that's awesome. We've got a few minutes left, so I wanted to, the last topic we can talk about real quick would be the emotional behavioral regulation, and some tips and strategies for that.
Yeah, so I think that's also one of the biggest things that we see that kids and teens and some adults, I guess, deal or have trouble with, is that, you know, emotional behavioral regulation. So being able to regulate yourself in a situation where things aren't going your way. So whether it's and usually it's the, you know, the emotional difficulty comes out through behaviors with kids. So whenever we see that a kid is having problematic behaviors, most often it's because something else is going on underneath. So if they can learn how to regulate their emotions, they will be better able to manage their behaviors. So kind of teaching them how to regulate that for themselves. And then, you know, for the younger ones or the kids who aren't quite there yet, trying to work with the parent to help the child do that. Because sometimes if they can't do it for themselves, we have to help them do it until they kind of learn what it feels like, and then can do it for themselves eventually. That's the goal. So whether it's, like I said before, you know, like taking a break to kind of collect themselves and use whatever strategy works for them to regulate their emotions, whether, you know, it's music, whether it's silence, whether it's certain type of motion. Like I have kids that will go swing for a little bit and calm them, and helps them kind of regulate themselves. So for everyone, it's a different strategy, and I usually work with the child and the parent in figuring out, you know, what helps you feel relaxed. What are things that when you do them or see them help you feel better? For some kids, they like using strategies like, you know, visualization, where it's almost like a form of meditation, where you can kind of put yourself in the place where you would like to be and use that to help, you know, kind of collect yourself and bring yourself back. So different strategies work for different people, but that's, you know, we kind of work together on figuring out what works. And sometimes it's a process of, let's try this and see how it feels and what's working, and we troubleshoot from there.
Do you find that parents ask you questions in regards to what may be perceived to be a stimulatory type of behavior? I'll use like spinning as an example. So a child that consistently spins, you know, throughout their day, but that could potentially be a coping mechanism as well for
Right.
them. So how do you, is there, I mean, there's certainly no foolproof way to tell the difference between a stim, if it's pure stimulation versus a coping, or it could be an overlap. Do parents ask you questions, or does that come up in conversation oftentimes?
Yes. So I've had situations where, you know, a child is engaging in, those self-stimulating behaviors, and the parent is so concerned over stopping that when there's all this other stuff going on. So until we can tackle that, we can't take away the only coping mechanism that the child has right now.
Right.
So it's kind of like a step-by-step process, and you can't jump to step 10 before we started step 1.
So one way to look at it is ultimately would be to replace, that with some other option that might become available as time goes by.
Yes, and depending on the case, I would kind of look at the big picture and see, okay, so how much of a problem is that behavior? If it is causing this child to lose friends, and it's something that's so big that it's getting in the way of them being able to function in other areas, then that's a bigger deal, and we want to be able to tackle that first. But if it's something small that's not really disruptive or not really causing too much impairment in any other area, let's leave that for now. Let's tackle the bigger issues, and then we'll get there when we've dealt with all of this other stuff first.
Makes perfect sense.
For more specific strategies on dealing with behaviors at home, make sure you check out our DIY language development parent training, where we really dive into specific strategies for promoting language and decreasing behaviors at home, as well as our posts on understanding your child's sensory needs and understanding your child's behaviors. We'll link to those below.